Check Your Health is brought to you in part by Intermountain Healthcare and the Utah Department of Health.
Talking food for health today, we have Rebecca Fronberg here from the Utah Department of Health to talk a little bit about food as medicine. And we know that there are a lot of foods you can eat for preventing bad things from happening to your body, right?
Well, basically fruits and vegetables, primarily because they're so full of antioxidants and things that help our body to heal. But I think people are leaning more to realizing that we are what we eat. I mean, we've heard that before. We've heard, let food be thy medicine and let medicine be thy food. But we forget that. I think we forget. We get used to eating what tastes good and not always what is good for us.
And what should you be looking for? The more colorful, the better?
Oh, absolutely. Eating a rainbow is a really great habit to get into. And variety is the key, because there's all kinds of different nutrients and different things. So one vegetable or fruit may not be necessarily better than the other, but darker fruits and vegetables that have deeper colors are generally the best as far as preventing and treating disease.
I know some people will say, oh, Brussels sprouts, no way. But there are some really good ways to cook some of these vegetables, to lightly cook or eat raw. We had a salad recipe for Brussels sprouts the other day, and it was fantastic.
Well, I love Brussels sprouts, but I'm probably one of those strange people. But I think, it's physicians as a whole, physicians haven't always been used to prescribing food as a they give you a prescription for something else. And exercise as medicine is obviously gaining ground, where a physician will write a prescription for exercise. And now we're leaning toward what we call green prescriptions, which are the same thing, physical activity nutrition prescriptions that can help with things like diabetes and heart disease.
And if you are sick, if you have a cold or a flu, there are some foods that have medicinal purposes as well. Garlic.
Chicken noodle soup.
There's a reason.
Lots of vegetables.
Yeah, lots of vegetables and garlic and onions that have those good qualities. Okay, and if anybody ever has questions, they can always get a hold of the folks at the Utah Department of Health. We have a link on our website, so go to KUTV.com or choosehealth.utah.gov.
Yep,
ask them any questions. They'll help walk you through it. All right, Chase, get some fresh air.